We don't often think about it, yet we rely on it for so much. Skin isn't just the largest organ of the body, it's the one we present to the world every day. And over our lifetime, we subject it to a lot of abuse. Think about all the tough conditions our skin experiences just going about our daily lives, sitting in the sun, waiting for a bus in the cold, falling over and grazing our knees. It's all part of life, and life takes its toll on our skin. When we're young, our skin steps up to these challenges by constantly renewing itself. We develop new skin cells and shed the old at a rate of around 40,000 cells every day. But as we age, this process slows down. Our skin becomes thinner and more fragile. It can take up to 4 times as long to heal. Older skin needs care and understanding to protect it, especially when a person is living with a skin condition. We'll help you to identify some key skin conditions, as well as the psychological and emotional impacts they can have on an older person. We'll also share some general advice and tips to help people feel comfortable and protect their skin from damage. The skin is made up of 3 layers, each with its own important parts. The upper layer is the epidermis, which forms a protective barrier against the environment. Below the epidermis, you have the dermis, which contains nerve endings, hair follicles, oil glands, and sweat glands. It also contains collagen and elastin, which are tough and stretchy, giving the skin its elasticity. Tiny blood vessels bring the oxygen and nutrients needed to keep skin cells healthy. The bottom layer of the skin is called the subcutaneous layer. It's made mostly of fat and helps the body stay warm and absorb shocks, like bumps and falls. Smoking, sun exposure, and the environment we live in all have an impact on the skin. But age brings its own challenges. The strength of the collagen and elasticity of the elastin decrease, leading to increased sagging and wrinkling. Skin is generally thinner, more fragile, and the protective subcutaneous fat layer becomes thinner. Older skin is also vulnerable because older people are often less mobile and may need to take medications with unwanted skin side effects. All these factors make older skin more prone to bruises, tears, and skin damage like ulcers. If someone has a skin condition, there can be added challenges. Dr. Maggie Kirkup is a consultant dermatologist and a founder member of the Senior Skin Group, a UK-based organisation dedicated to educating people about conditions affecting elderly skin.
Older skin needs extra attention and care, not least because it's more susceptible to certain skin conditions. Let's take a look at some of the more common conditions and their symptoms. Firstly, dry skin, or xerosis as it's sometimes known, when the skin loses its ability to retain water. This can be really uncomfortable and sometimes quite painful. It can be age-related, a side effect of medicine, or the result of environmental factors, things like the use of soap, smoking, stress or sun exposure. Nutritional deficiencies can also be related, and it could be a combination of any of these things. Then we've got eczema, which can also be known as dermatitis. There are several different types of eczema, and it can be very mild or it can be quite severe. It can be itchy and make the skin dry and red, but when it's more severe, it can weep and bleed, become infected and very sore. Eczema can be a lifelong condition which changes with age. Some older people may have had it for life, while others may develop eczema for the first time when they're older. Next, psoriasis. This is often seen on the elbows, the knees and the scalp, but can affect any part of the body. It causes red flaky patches of skin which can be large or small, and they're often itchy or sore. It can give a nasty rash in the skin folds, such as under the breast and in the groin. Some people won't find their psoriasis too troublesome, but for others it can have a huge impact on their quality of life.
You get a crust on the skin and the skin flakes, your hair, get it in your hair and your hair flakes so it looks like dandruff. I get it on my face, so my face reddens.
Then there are skin lesions to be aware of. Some forms, such as seborrheic keratosis, can be benign or harmless, but others may be skin cancer or lead to skin cancer, such as the solar keratosis. Seborrheic keratosis can be seen as warts. Seborrheic is a reference to the grease glands, and you can see why it got its name. It's a greasy, yellowish or brown, stuck-on looking wart-like area which can itch, and it might bleed occasionally if bumped. It can be totally harmless, although unsightly. On the other hand, solar or actinic keratosis is sometimes called a sunspot because it appears on skin that's been exposed to the sun, like the face, the arms, the lower legs, as well as the scalp for bald men or those with thinning hair. It appears as red areas on the skin which are often scaly or crusty. It's usually benign and non-invasive, but it can become cancerous, so it's essential to be on the lookout for any changes in the size, the colour or the shape. The most aggressive type of skin cancer is a melanoma. These often have several different shades of brown or black in them. Their outline is irregular and they keep on growing. But caught at an early stage, they can be cured, so we have to be on the lookout for them. The increasing number of skin cancer cases each year has become a substantial public health problem. Over 80% of skin cancers occur in people aged 60 years or older. We know the majority of skin cancers are caused by exposure to ultraviolet radiation in sunlight, and they can be extremely serious if they're left untreated. Always take care when people are outside to help them keep their skin protected. And as care workers, you see the older people in your care every day, so you have an important role to play in helping them to protect themselves and look out for possible signs of skin cancer and any other changes so you can report them. You can follow the A, B, C, D, E guide recommended by the American Academy of Dermatology. You should check for A, asymmetry. If you drew a line through the middle of a spot, you'd end up with two identical or symmetrical halves, whereas spots that are cancerous are not the same on both sides. B is border irregularity. Non-cancerous spots have a smooth, not a jagged or uneven edge. C is colour. A mole or spot that isn't the same colour throughout or has shades of tan, brown or black should always be evaluated by a doctor. D, diameter. A doctor should examine any spot that's larger than the eraser on the end of a pencil. That's about 6 millimeters. And E is evolution. A mole or skin lesion that looks different from the rest or is actually changing in size, shape or colour. In order to monitor an older person's skin effectively, they should ideally be assessed when they first enter a care home. That way you'll know what's normal for their skin. Then aim to assess skin as part of everyday care, noting the general condition and any changes. These changes include skin becoming drier, scaly or flaky, any itching, and any general changes in colour, shape or size. Ask residents if they're worried about their skin and if they've noticed any changes themselves. It's important too to ask about overall well-being. Does their skin condition prevent them from doing anything, for example? By finding out just how a skin condition is affecting the individual you're caring for, you can judge the best way to help them and understand the significance of any changes or new symptoms. Even if something seems minor, it could turn out to be very serious, so record it in the care plan. Stay aware, be on the lookout for changes to the skin and never make assumptions.
Julie Van Onselen is a dermatology nurse and trainer with years of experience caring for skin.
Living with a skin condition can have a profound physical, emotional and psychological effect on people. It's all too easy to dismiss skin conditions in older people as one of the more minor care issues. But some skin conditions can cause such pain and discomfort that basic tasks like bathing, dressing, and even eating can become very difficult. Sometimes even general mobility can be impacted if skin is sore. For some people, skin conditions may be mild and easy to ignore, but for others, a skin condition can result in disability levels equivalent to those experienced by people with chronic diseases.
I got itching, obviously constant itching, particularly around the ankle area, and on the chest and the back, and various parts of the body would sort of flare up there particularly, and it's going to bed where you can't ignore it because you're just lying there.
Lots of skin conditions can cause itching, known as pruritus. It can be extremely uncomfortable, affecting all kinds of activities we'd normally take for granted. Itching can stop a person from relaxing. It can even stop them sleeping, which can have a serious impact on well-being.
Iris, I'm going to put a cold compress on your arm.
The aim is to stop it getting to that point by making people as comfortable as possible.
Does that feel better?
Physical impacts are easier for us all to see than what's happening in a person's mind, but the psychological and emotional impacts are no less difficult for many older people. Common feelings for those living with a skin condition include shame, depression, anxiety, stress, anger, loneliness, and low self-esteem.
Our skin is our only direct link to the world. It's how we present ourselves to the world. But it's also how we interact with it, through touch and even with signals like blushing.
Even treatment for skin conditions can be a challenge in itself for older people. They may need time-consuming treatment applications, sometimes several times a day, and this can obviously be very draining, repetitive, and get in the way of other activities.
It is very time consuming. You know, if you've got psoriasis in the scalp like I have at the moment, you have to put treatment on it late at night and then, or early evening if you like, so to be able to wash it off early in the morning, and then you know, it's the time to prepare yourself if you've got psoriasis on your arms and it becomes scaly, that you've got to use emollients to try and smooth out the skin.
Our skin, and the way we feel about it, is a very personal and complex thing. It also has different meanings in different cultures. For instance, some older people from ethnic minority groups may have different needs and sensitivities when it comes to their skin. There are lots of general misconceptions about skin conditions, but what is myth and what is fact?
If somebody has a bad skin, they should wash more regularly.
Not quite true. In fact, soap is one of the main culprits for drying skin out. Overwashing is very bad for dry skin conditions. It's all about being as gentle as possible.
Skin conditions aren't life-threatening or serious, right?
Not always so. Skin conditions can be life-threatening, particularly if they aren't treated, become infected, or if changes in the skin aren't reported in time for effective treatment.
So, all skin conditions are contagious?
Actually, most skin conditions are not contagious. The conditions that we've looked at, such as eczema, psoriasis, and seborrheic keratosis, can't be passed on. But a small number of conditions, such as scabies or impetigo, are infectious and need to be controlled to avoid them spreading from person to person. Research tells us we could do much more to support older people with skin conditions. In the past, we've focused care on preventing and treating ulcers, as well as looking after existing conditions. But if we can take more time to focus on promoting good overall skin health in older people, we can provide a major boost for the mental and physical well-being of residents. When it comes to skin care, there are several key aims. Protect the skin by using effective skin barrier creams. This reduces the likelihood of skin breaking down by reinforcing the skin's natural waterproofing and protective layers. Look out for and report changes to the skin promptly. Make sure people are as comfortable as possible. and support people to manage their conditions themselves where possible, so they feel in control and better able to cope.
A regular skin care routine is an important part of managing skin conditions. There are lots of opportunities to protect the skin and to promote good skin health throughout each day. The key thing is to understand what routines, medications and products work for the particular person you're caring for by discussing and documenting the person's preferences and referring to the care plan. What works for one person might not suit someone else. A good example is emollients, which should be an individual choice.
Now, I think I'll have that one.
Oh, okay.
If I point to it.
Good hygiene and emollient use sit at the centre of skin care routines for older people in order to manage dry and itchy skin. Emollients soften and smooth the skin. They also provide a protective layer and a barrier that helps prevent skin drying out. The moisturising effects of emollients replace those natural oils that older skin can lack. There's a wide selection of emollient creams, so there's something to suit everyone. Some are simple oil and water solutions which should be applied several times a day. Other humectant creams contain natural moisturising factors which last longer and replace the moisture in the skin's barrier. Some creams also contain anti-itch ingredients.
Now, as we mentioned, soap can cause skin to become drier, irritated or itchy. So can perfume products and bubble baths. It's best to avoid them. Use a leave-on emollient instead, or if the person prefers, you can use the bath oil or an emollient wash. Washing once a day is good for dry skin conditions if emollients are used instead of soap. Just be aware that emollients can make the washing area slippery, so it's important to ensure they don't present a hazard. Hands are one part of our body that gets washed very regularly, so an emollient soap substitute can be applied first. Then, either let the emollient soak away or gently place the hands together and wash, ensuring the water isn't too hot as that can damage skin. If skin is wet or weepy, there may be a skin infection. Antimicrobial washes and bath oils can be useful as a short-term measure to reduce bacteria on the skin and prevent reinfection. This principle of using soap substitutes can also be applied to the whole body and used for bathing or showering. Advise the older person to cover their whole body with the emollient before getting into the shower and then simply wash it off. As we said before, ensure the water is not too warm as hot water can cause more itching and discomfort. Remember to wash the person's hair separately from the bath or the shower, as the shampoo will wash onto their skin, undoing all the good work of the emollients. If the scalp is dry or itchy, a medicated shampoo or gentler option may be a good idea. I'm here today with Tricia Venables,
Hello.
who's kindly volunteered to help us demonstrate some key points. After washing, it's important to dry the skin well. Use a soft towel and pat rather than rub dry. Make sure all the body creases, such as between the toes, but also under the breasts and around the groin area, are thoroughly dried to prevent chafing. Just remember to be sensitive, as some people may feel uncomfortable being touched in these intimate areas. After washing and drying, you can apply leave-on emollient to the whole body. Just putting on my gloves. So you need to use this generously. So pump quite a large amount into the hand. And then the idea is to get the emollient evenly spread over the limb of your foot. You dot on the emollient, again pretty generously around the whole limb. And then in long downward strokes, smooth the emollient into the skin, just leaving a thin film of emollient. Hopefully that feels quite nice, is it, Tricia? Yeah, you like that? And then leaving the thin film to dry. Regular emollient application can be very beneficial when caring for an older person's skin, and it is the best way to prevent dry skin and improve dry skin conditions. There are a number of ways you can help people to apply it as regularly and easily as possible. Encourage people to keep a small pot of their preferred emollient handy and regularly reapply it to any itchy areas. If skin is very dry, emollient ointments may be needed. They are greasy and will stain clothing, so it's best to use underdressings or at night before the older person goes to bed. Ointments tend to come in tubs. Be sure to prevent contamination by decanting the amount of ointment required for the application rather than using fingers. Apply in the same way as cream with the dotting and stroking technique. Care workers can help people who wish to be independent by helping them to apply the emollient to the back of the hand, which will give them a wider reach. Creams can also be applied with long handle sponges, useful for lower legs and backs. However, it's important to wash the sponge after each application, and this isn't suitable for ointments as it will be impossible to wash out the grease from the sponge. After moisturising, encourage residents to wait for 10 minutes and let the leave-on emollient soak in before they get dressed. Avoid damaging the skin by being as gentle as possible when helping an older person to dress. Encourage older people to wear clothes made of soft cotton and natural fibres. Make sure clothes aren't crumpled, rough or too tight. For particular conditions, topical treatments may also be prescribed. That's medication that's applied to the skin. Make sure you refer to the care plan and understand how, when and for how long to apply treatments.
You can prevent many skin problems by being aware of some of the key risk factors older people are likely to encounter in daily life, and taking steps to manage those risk factors. When caring for an older person, look out for factors that might make them more vulnerable to skin conditions. Sitting or lying for long periods of time can cause problems, because there's more pressure on a smaller surface area, which can make skin more vulnerable. So it's very important not to underestimate the importance of frequent repositioning.
Well, the bedding obviously is an important aspect. Don't get overheated, really, is a main thing. And then wear loose or light wear socks, because particularly around the ankles, that can be very irritating.
Creased linen may just be uncomfortable for younger skin, but it can be a source of friction and damage for older skin, so always try to avoid creases. Moisture and acid from urine and feces is another real hazard for skin, as it can break down that all-important protective surface layer. Effective continence management is essential to help prevent skin problems. Look out for possible contact with sharp objects. Even rings and long fingernails could cause painful damage to an older person's skin.
Always avoid any kind of friction. Using too much force to move a person can cause that area of skin to be dragged, which can result in painful burns or cuts to the outer layer of the skin. As with most things in life, eating right can make a difference. A nutritional and varied diet and lots of water give skin the best possible chance of protecting, healing and renewing itself. Encourage older people to eat well and keep hydrated. Offer them fluids throughout the day and make sure they're getting enough. Protect older skin against the cold and the wind by encouraging older people to wear a hat, gloves and scarf. And whilst it's important for vitamin D levels that older people get enough time in the sun, make sure they wear a wide-brimmed hat to protect their face, neck and ears. Always encourage them to use a high-factor sunscreen and wear appropriate sunglasses to protect their eyes.
When a skin condition does occur or flare up, it's important to report it quickly, so that it can be treated to avoid pain and reduce the risk of infection. The main aims of any treatment are always to protect the skin from further damage and promote healing.
Older people with a skin condition can sometimes get frustrated, agitated, upset or angry. This can make caring for them more difficult. There are a number of behavioural therapies that can help. Relaxation training and habit reversal training can work alongside treatment and help with feelings of frustration, anxiety or depression. It's another thing to consider in your overall treatment plan.
If you go for a walk, that distracts you from worrying about a particular area. You don't sit there and feel itchy. You get up and move about and let the circulation hopefully do some good.
Residents with dementia may cause regular damage to their skin through scratching and get confused and anxious, but it's important to be flexible, patient and calm. If someone doesn't want to be bothered with their skincare, it's a good idea to try again at another time when they may be in a different frame of mind. It helps to make sure you have everything you may need, emollients, dressings or whatever it may be at hand. That way you can treat the residents quickly and simply as possible. This will also help avoid unnecessary distractions or delays, which may help when treating more challenging residents. Distraction therapy, such as engaging the older person in a helpful task or in their own care, is another great tool, particularly for managing itching. It can also help the person learn how to look after their own skin, which in turn will help them feel more in control and cope with their condition more confidently. With all of these situations, and when caring for skin in general, it is just important to remember to ask. Find out what the person needs and how they've managed their skin before. Understanding their preferences will give you a better chance of keeping them comfortable and protecting their skin.
Our skin is our connection to the world around us. So when it becomes damaged or vulnerable with age, the impact on our bodies and minds has the potential to leave us feeling very isolated. Skin is a sensitive subject in more ways than one, but by promoting the skin's natural barriers, doing all we can to help people feel comfortable, and enabling people to manage their conditions independently, we can support a greatly improved quality of life and help the people in our care to be comfortable in their own skin.